You may tomorrow be gone, tomorrow may never come. Wake up, wake up, wake up, wake up to purposeful living now. That in this you will build your soul, in this you will be the difference, in this you will be the answer to the prayers of humanity. In this you will build your soul, in this you will be the difference, in this you will be the answer to the prayers of humanity. To live and not know what state of God you are.
To live and not know the state of God that you are is certainly a disaster.
To not know your purpose is a tragedy.
And not to know your purpose is a tragedy. And certainly a huge tragedy.
Sunshine, rainfall, half spins.
We back again
Harmony.
on Mentoring Hour, coming your way from One-to-One Mentoring Network,
Sunshine, rainfall, half
the organization with all beautiful women.
harmony, symphony.
And not just that,
The world is
beauty with intelligence,
on you.
beauty with purpose.
Do you feel
Today I have with me
the world is waiting?
a set of 3 beautiful women again.
Shine
But I'm always lucky to be among women. We have Dr. Stephanie Adeyemi.
star.
We have Jasmine.
Shine so bright.
And we have, I hope I get the name right, Dion Thompson. Well, if I don't get it right, correct me. And our focus today
We gone, tomorrow may never come. Wake up, wake up.
is on Black maternal health.
Living up. And this you will be.
Black maternal health.
This you will be.
Quite interesting.
And this you
When I saw the topic,
answer to the prayers of
I was asking myself, why
you build your soul. And this you will
do black women
be friends. And this you will be the answer.
have a special problem for us to have a focus on their maternal health? Well, let's keep it there and welcome our guest this very morning on Mentoring Hour. Good morning, Dr. Stephanie. Good morning, Jasmine. And good morning, Dion. Yes, I hope I've got it right. Yes.
Morning.
Good morning. Good morning. Good morning. Good morning. Good morning. How are we all doing?
Good.
Good one there. Have we all had our boosters?
We have.
We have indeed.
So you are.
Have you had yours?
Not yet. Not yet. Oh, interesting. Well, I know we are going into maternal health, but just a little bit on this new variant that is on there. It is heightening a little bit of the conspiracy theories that this thing is going to be ongoing here and there, and it's just a way of siphoning money from governments here and there. Just a little bit on that, and then we move on to the topic for today. Any one of you can go. If Dr. Stephanie or any one of you, yes, can go. Well, I'll go with Jasmine. Yes.
I think it's scary times. I think the new variant is essentially saying that this pandemic is far from over, and it's probably we'll have more variants to come. I think there's still a lot of uncertainty, and we're not sure in terms of how easily it spreads, and we have to think about whether the vaccine is effective against the variant. But I think it's an important message for all of us that we still need to be vigilant, and in terms of our activities, making sure we're being vaccinated or getting boosters, and also to maintain, wearing masks in crowded places, public transport. I was glad to see the government at least I think it's a bit late to say that, in terms of masks being mandatory on public transport and shops, etc. But I think we just need to we need to take responsibility. I think ourselves, our teams, and to protect ourselves, our communities, families, and women against this COVID and whatever new variants that we might experience.
Is there a possibility of another lockdown on the way?
I'll let Stephanie, you go on, Steph. Go Dion.
Stephanie, I think you're on mute. Yeah.
You're on mute.
I think it's very difficult to say. I think that's not something that anyone would want. So hopefully, if we take the precautions, we follow government advice, hopefully we'll see that the numbers continue to remain stable or decrease, and hopefully we can avoid a lockdown. I think that's kind of the option that we're all hoping doesn't take place. So hopefully we can prevent it occurring.
Okay. All right.
I think we also need to do our lateral flows and take responsibility to not meet with people without testing. And in our workplaces, we test to keep our women and babies safe.
Okay. All right. Thank you very much for that. And I'll stay with you, Dion. Now we are at which one? The new variant is what? Omicron, yeah? Okay.
Correct.
Yes. Are we looking to go all the way to the alphabet to the Z before we finish? Or?
Let's hope not. I think it's something that we will be living with for a little while longer, definitely. Yeah. So let's hope we don't go through the alphabet.
I see. And certainly you are not with the very ones who are operating with a conspiracy theories. You don't work with them, right? No.
We don't. We see how this virus affects the women that we care for and our babies. And we are very much working to look after women who get the virus. And also to try and educate and protect the women to not get the virus and to be vaccinated to try and stay as well as possible. That's really a big aim of ours. We're not conspiracy theorists.
Okay. It's quite interesting. I have someone who works with NHS and one of these maternity wards. And this pregnant woman came in and she had tested positive. And as per what this person is telling me, everyone on the ward was running away from her. Everyone was running away from her. So I appreciate your work. I appreciate what you do, standing at the forefront of this pandemic and giving us your support. Thank you very much for that. Now, we go straight away to the topic for today. But before that, we haven't seen Dion here before. We don't know about you. Tell us a little bit about you.
Thank you. My name's Dion. I am a midwife. I work with Yasmin and Stephanie, and I've been a midwife for 15 years and had a career within the NHS, starting as a support worker to now be a senior midwife. So that's looking after women and babies.
You started as a support worker.
I did, yes. I started as a band 2 support worker. 25 years ago, and now I'm a senior midwife. Yeah.
Wow.
So I worked my way up.
I love that. I love that. In fact, when we finish the show, Pepper's song is especially for you. Okay. Yes.
Thank you.
Good one there. Then I'll begin with you. Why are we only focusing on Black maternal health? Is there any special reason for that?
Yes. We know that people of colour, Black women and brown women, do worse within our maternity services. We know that they are more likely to die within the pregnancy journey and their babies. And so we are all working together to try and improve care for women and babies in lots of ways.
Wow, quite scary. You said black women are more prone to dying during pregnancy. Is that what you said?
It is, yeah.
Dr. Adeyemi, Stephanie,
Yes.
quite scary, isn't it?
Yes, yes, it is.
What makes it so then? What?
I think it's a number of different factors. When I was looking through the literature, they mentioned the fact that a lot of women of color, a lot of Black women, tend to potentially live in deprived areas, so that can also be a factor as well. So it's a number of different factors that have led to the kind of results that we're seeing now. But it's important we talk about it so we can start to kind of make a change and reflect on how we can do things differently and hopefully lead to better outcomes for women and babies.
Wow. Then today we will be like insurance sellers, right? The people who sell insurance, they will tell you the gloomy picture and then you make a decision. Tell us some of the things that we need to know about black maternal health so that people will know their stand and then make a move on that.
Okay, so for example, looking at the literature, evidence suggests that Black women are 4 times more likely than their white counterparts to die during or after childbirth. So we know that, for example, in the UK, this is an issue that we need to tackle and do better on. You can also see within Asian women are also more likely to die during childbirth, as well as mixed race women, but Black women have the highest numbers in comparison to their white counterparts. So we know that there is something going on that we need to tackle and need to do better on. Now that we are aware of the evidence, I think we're then able to kind of see what we can do to make a change, to make a difference for these women. So some of the literature I saw mentioned it's important to have kind of advocates for Black women. It's important that the care that women receive reflects the population that they live in. So it's important that they have Black midwives, Black obstetricians, Black doctors involved in their care. So it's just a number of different factors. It's a very complex picture, but I think now that we know what the situation is, I think it's important that we try and make a difference and make the changes, which is why we thought this would be an important topic to discuss.
Okay, all right. I'll go to you, Jasmine. Is there something in our biology that is causing this? In the biology of black women causing this?
I don't think we've got the answer to that, to be very honest. But as Dr. Stephanie said, it's a combination of factors, I think, and from in terms of where women live, for example, whether they're in deprived areas, so that's a very complex thing in itself. Sometimes we also know that Black women have other medical conditions. So, for example, they may have things like diabetes. Some of them may have high blood pressure. So that's additional. They may put them at additional risks. So I don't think there's a genetic component to it, but obviously a lot of more research is needed, and which is why nationally there's a lot going out there now to put a focus on looking into the data that we have in a bit more detail. There are other elements in terms of women accessing care. Also how we communicate with these women when they do come to us. Some of them, are fearful of coming into the organization, or fearful of, the interactions, fearful of the service. And so it's about exploring all of these reasons, for why we have these poor statistics. And it's not just with death, Papa. We also have, the COVID. We've seen it COVID as well. That's also managed to escalate some of the issues in terms of, up to over 55% of women admitted in terms of pregnant women with COVID. Again, were from Black ethnicities, and also Asian ethnicities as well, and even women who died from COVID as well. Up to probably 60% of them were from Black and other ethnic minorities. So it's a big issue, and it's sad in a way that it is what it is. And in terms of maternal morbidity and death, it's been going on for lots of years, and we've been aware of some of these statistics. But I think certainly now, with COVID, there's a lot being done nationally to try to, bring this issue to light, and lots of drives to try to address these disparities.
Beautiful. I think you said it, and Dion also said it. Where the women live, right? You said something like that, right? Are you talking about areas like Peckham or areas like Camberwell or what? Is that what you mean?
There are particular postcodes, yes. So that we know some deprived areas. Some it might be some in London, might be others up north. We've had, so like Lincolnshire. We know there are different pockets, even in the UK, that we know that women live in deprived areas. So it's a matter of getting that information. And what we realize as we try to address these issues is we don't have accurate data as well. So that's one of the things that we're trying to look at nationally to make sure we get the accuracy of the ethnicity codes for women, so we can really try to get to the bottom of it with regards to, deprivation.
I'll go to Dion. I just want to get to the bottom of that. When we talk about deprived areas in the United Kingdom, what exactly does it mean?
So it means people who are less affluent. Maybe there are issues with housing, where lots of family members may live together, and yes, they're deprived from services, from education. Um, they work in lower paid jobs. They maybe have more exposure to the public, and that's why they, with COVID, why they might have had extra exposure. It's about us trying to improve the community, so women all start with a good start, all start on the same level, and how we can interject services into that community to try and dispel, the inequalities and improve them. Yeah.
Oh, I see. I see. Now I understand what the deprivation means. So we have women who live in areas, clustered areas. Let's put it that way. They live with a lot of family members. That is to say, during pregnancy, the necessary care that they should get, they may not get during pregnancy. Is that what it means?
It means sometimes, as Yasmin said, the access to care. Sometimes there's language barriers, and we don't have the information in languages that they can understand and take away. Sometimes women don't know the processes of the health service, and so they don't access it when they need to. It is really complex, the reasons, but we are doing a massive deep dive, trying to, as Yasmin said, get the correct information to make a difference.
All right, I'll still stay with you. What do I do? Say I'm a black woman. The very moment I get pregnant, I see that I'm pregnant. What should I do?
So the first thing you need to do is refer yourself generally to the local hospital. Most hospitals have a referral system for you to access, and you will then get an appointment with your midwife, where she will book your pregnancy and risk assess you and help you to be on the correct pathway. Most women of childbearing age are able to access information on the internet, and there is a lot there. And that's one of the things we want to improve, to have that in different languages.
Okay.
There's a mother and baby app that has a wealth of information. And trusts are now starting to try and provide that information in languages for all women to understand.
Okay, so the first thing is to refer myself to the GP or the midwife. Which one?
You can refer yourself straight to the hospital, to the maternity unit, often online. Maternity units have a form for you to fill out.
Okay, that is at the early stages. Say I discovered that I'm just about 2 months pregnant, or right?
Yeah,
2 months.
and the earlier the better. We have lots of screening programs that women can access if they want to at an early stage of pregnancy. And the earlier you do that, the better.
The better, right? Okay. All right. Stephanie, anything more you want to add to? Go on. Yes.
So I think that that's the most important thing. It's kind of accessing services early, because I think from there they'll be able to offer you the support and the advice that's needed. Be able to, as Dion said, do all of the necessary assessments, checking blood sugars, doing urine dips, doing all of the things that need to be done early on in the pregnancy, just to make sure things take place as safely and as smoothly as possible. I think also it's about kind of asking questions as well. So once you kind of liaise with those services, any concerns you have, anything you don't understand, it's important to feel confident enough to ask questions, and to fully really engage with the services as well.
All right. I'll stay with you. We are focusing on Black women, and one area that we can also tackle is immigration status, right? Yes. So let's say I'm here, I don't have the right status. Should I still go to the midwife, the maternity, to do the report? Are they not going to report me to the Home Office?
That's a very good question. I would still say it's important to engage with the midwife early on, regardless of your immigration status. It's important to engage, because what we find is women, for fear, for a number of different reasons, such as immigration status, may not engage early on, then run into issues later on in their pregnancy that could have potentially been detected or avoided. So I think it's definitely worth engaging early on, regardless of immigration status. What happens in regards to kind of reporting is something that I may have to ask my colleagues about, as I'm not entirely sure what would happen in that respect. But I think the main thing is to engage early on. Once you find that you're pregnant, engage with the midwife, engage with the necessary services.
That was where I was going, because when you finish with your baby in your very happy mood and what have you, they will come and put a huge bill on you that you have to go and pay. So Dion, what happens if someone comes in with no papers? Let's put it that way. The immigration status is not appropriate, and they give birth. What happens? Is it for free?
It's a really tricky subject. We do have departments that look into how women will pay for their care. That's definitely true. And there is a big campaign to make services for women who are having babies for free. At the moment, you will be provided with all of the care that you need. And at the moment, I think there are issues with payment, but I also think there are charities and things that will help to pay for that. Yasmin, are you?
Yeah, well, I think the primary thing to say is that women will not be denied care, and that's the key thing. That's the key message. There is a backlog, fair enough, of payments and receipt and trying to retrieve payments from the service. I can't give you the figures or the numbers, and there are processes in place to try to support women to access the care. But it is a challenge. It's a national challenge for us, and we've had work even coming from, we have the refugees, for example, coming from Afghanistan. So lots of other groups as well that we're having to support, and there are policies and national policies in place to support these groups. But the key thing is to say that these women wouldn't be access care. They wouldn't be shipped off somewhere else. They wouldn't be sent, but that's been taken at a national level and a regional level to support these women and to support trusts to manage these cases.
Okay, beautiful. So at every stage of the way, there is support, and I love it. As you said, women are not going to be denied care based on their status. That is a huge plus. So whatever the case may be, you still have to refer yourself, right?
It's important to look after you and your baby. We want to look after you and your baby.
Excellent. Well, I know people take some medications here and there during pregnancy, right? Is that necessary? Is this something that Black women should also be very, very mindful of. I know the very moment some people realize they are pregnant, they start taking some medication throughout the pregnancy. Is that necessary? Dion.
It's really important if a woman has a health need that she takes the medication needed to manage that. Absolutely. The medications that we use, we make sure that they're safe, and we go through the risks and benefits of these medications with the women. One of the big things is the vaccine. We promote women to have the COVID vaccine in pregnancy because we know the risks of them being unvaccinated, and becoming much more likely to become unwell.
Now we will come to the vaccine. Now, on the medication, right? Is it something that they can get off the counter, or it should be prescribed to them?
So if we're talking about, for example, vitamins, like folic acid, you should be able to either access that via your midwife, or I think they also sell over-the-counter pregnancy vitamins that you can pick up yourself. So lots of them will have folic acid up until about 12 weeks. Sorry. And can also have vitamin D as well if they need it, if that's something their midwife recommends.
So in terms of your other medications, so in terms of Stephanie mentioned vitamin D, so that's one of the big things we're promoting, especially for women of color, and in terms of benefits, and also in terms of protective effects against COVID. So it's one of the big areas and a big piece of work in terms of trying to ensure women of color have the correct advice. Other pregnancy supplements we talked about, and iron tablets, or potentially ferrous sulfate some women might need to take if they've got low blood counts. Other medications that they may be on. So, for example, women might be on blood pressure tablets. So there's certain ones that are safer to take in pregnancy. So there's national guidance around some of these medications. Women who may have epilepsy, again, there are some that are safer to take that we would normally switch them onto. But some of the medications we encourage them to take would be tablets for example, mental health. Women who have mental health conditions, we normally ensure that they would see the GP and have a team approach to supporting them to make sure that they don't come off these medications, because their welfare is so important to support them through the pregnancy. So it's a matter of having that conversation, making sure women don't just stop taking things that may be detrimental to their health and then end up with poor outcomes. So there's lots of guidance out there to support professionals, the GPs, and us to have these conversations to make sure these women are not depriving themselves of the care and their medications.
Interesting. Now, you made mention of vitamin D, right? And I know vitamin D, the very moment COVID came, there were articles here and there on vitamin D, the insufficiency of it in especially black people, right? Jasmine, a little bit on that. The insufficiency of vitamin D in black people, has it got any link, any impact during pregnancy?
Yes, so I think, we know in terms of the benefits, so all women, there's certain high-risk groups, also not just black women, so we'd encourage vitamin D as well. And so, for example, women who are overweight, for example, so there's certain groups that we would normally encourage women to take vitamin D, but for every woman in particular, we would risk assess and have these conversations. And basic pregnancy vitamins we would normally recommend and prescribe in pregnancy. So it's certainly definitely a big national drive around vitamin D, and because something to do with our color and how we process, in terms of the metabolism of vitamin D and the intake of that. And I think we can put the conspiracies to bed that you can take vitamin D and it's safe to take. So I think the women need to be made aware of that and encourage them to take these supplements.
Yeah.
Okay, all right. The conspirators, the conspiracy theorists, they are always awake. They are listening to you as we speak now. So now,
and vitamin D is available for free
For
as
free.
well.
Okay.
You can get it from your children's centres. You can get a prescription from your GP. It's not a cheap vitamin to buy, and so we encourage women to access it for free.
Okay. All right. Now, talking about some of the care, the support that are available for free. Just as a midwife, take us through some of them. You have now said vitamin D is available for free. What are some of the services, the facilities that pregnant women can access for free?
Well, they can assess children's centres. They have lots of things there to help with housing, with benefits. There's lots of charities who support women with material things for their babies, you know, nappies and Moses baskets and clothes for women who don't have much money. There's lots of peer support, so groups where women can go and chat with each other and find out what services are available and to support each other.
Okay, all right. But they can't jump on public transport for free, yeah?
No,
No,
they can't do that.
they can't do that, right? Okay, all right. Now,
But they if they have a hospital appointment and they're on certain benefits, then they can get that money reimbursed. The person who they see needs to fill out a form, and then they take their proof of benefits and their ticket to the cash office, and they can be reimbursed for their travel to and from the appointment.
so there's something there. So if you are going for an appointment, and you are on benefit, you can be reimbursed for your travel expenses. There's something.
Absolutely. Yeah. If you have to attend regularly because you've got health concerns, that's a really important part.
No, okay, all right. Still on you. You made mention of the vaccine, right? Once again, will be insurers. If a black woman is pregnant and decides, no, whatever the case may be, I am not taking the COVID vaccine, what are some of the complications that could come her way?
We know that women who are more likely to end up in the intensive care unit who have not been vaccinated against COVID-19. So we know that it increases the risk of being more unwell for them and, of course, their babies.
All right, I'll move on to Dr. Stephanie on the same issue. You see, this vaccine issue, I was hoping people seeing all that is happening here and there will be settled to take it. But I don't think it's still settling in quite well. When you go to places like Germany, they are banning people from pubs here and there because they don't want to get vaccinated. I think I read over the week that in Greece, over 60s who decide not to get vaccinated, they will be fined £85 every month. 85 pounds every month until you decide to get vaccinated. It's quite intriguing, and it's just all over the place. Now, still on pregnant women. Tell us, give us the picture. What is so scary about being pregnant in these times and not being vaccinated?
I think, as Dion said, we can see from the literature that a lot of women who have not been vaccinated are at a greater risk of being admitted into ITU. We know that there are kind of worse maternal outcomes for women who do have COVID and are pregnant. So I think when we look at the literature, we can see there are a lot of risks associated with being pregnant and having COVID. And the advice is that women who are pregnant can be vaccinated safely. So we know that given the risks, given the benefits, the advice that the Royal College of Obstetrics and Gynecology are giving is women who are pregnant should get the vaccine. that it's important. It's not something that should just be left to chance. That given the fact that we have so many new variants emerging, given the fact that often women have to, for example, leave the house and may potentially be exposed to COVID, it's worth being vaccinated, getting the vaccine for the safety of mother and baby.
For the safety of mother and baby. And will the baby survive when the mommy is gone to intensive care unit? Will the baby survive?
I think it's very difficult to say, in the sense that it really is a case by case basis, and it depends on the severity of the COVID that the woman has. But going to ITU means that the woman has a severe COVID infection, means that she's particularly unwell. So the maternal outcomes are likely to be much poorer than in a woman that doesn't have COVID or isn't in ITU. But it's difficult to say for sure if the baby will survive or won't survive, but we just know that the outcomes are more likely to not be the best if she's gone to ITU because of COVID.
We've been talking to members of One-to-One Mentoring Network, a body of intelligent individuals. I think your organization is more of women than men, isn't it? Because I've had only 2 men around here. It's all to do with mostly women, right?
No, so the organization is for everyone. It's for men and women. It just so happens that at this moment in time, there are more women than men. But we're trying to recruit men. We have a bridge program which caters specifically for young men. So we're really trying to recruit men. But currently, numbers wise, there are more women involved than men.
More women.
But we're hoping that changes and becomes.
I see.
A different
Yes,
picture.
that is One-to-One Mentoring Network, and today, they're speaking to us on Black maternal health. They've touched on very important areas. They've touched one of the areas that are of much concern to me is the immigration status. As they said, even if your immigration status is not ideal, whatever the case may be, the very moment you get pregnant, you have to refer yourself to the maternity or the midwife, wherever that you need. You can do that online. You are not going to be denied the care that you need when you are pregnant, irrespective of your immigration status. Very, very, very important. And there are so many facilities that you can have access to free of charge. So you just have to, at all times, be very mindful of the fact that the very moment you get pregnant, you have the support that you need. Smoking during pregnancy. Smoking. Dion, should I carry on with those things? Alcohol during pregnancy, does it really matter?
Smoking, we know, is not good for your baby in pregnancy. We know that smoking is not good for our own health. We know that, and we know that babies have worse outcomes when women smoke. There is so much support. It is one of the big aims for saving babies' lives to help women to stop smoking. We know that it affects babies' growth. It affects whether they are born alive with the pregnancy if their mum smokes. We know the outcomes are not great, and we really want to help women to stop smoking in pregnancy. And it's a good time. We know that after babies are born, if mums smoke or somebody smokes in the household, that can increase the risk of a baby dying. And so the risks are high with smoking, and we have some great services to help women to stop.
Wow. Then let's talk about the services available for women who want to stop smoking during pregnancy. Because I know quitting smoking is not an easy task. And when women are pregnant, they have so many urges here and there, and sometimes they will need the smoke just to calm them down. So tell us a little bit about the services that are available to help women who want to quit smoking during pregnancy.
So women are asked at booking if they are a smoker. And if they let people know they're a smoker, then they are referred to a non-smoking service. Also, women at booking and throughout their pregnancy are asked to do a breath test to see whether smoking is detected, and a referral will be made for that as well. It's about education, to let them know the effects that smoking can have on their babies, and also support with patches and nicotine replacement and counselling, kind of a one-to-one checkup service with them. And they can take readings throughout their pregnancy, to and I'm not sure, is there money available if you stop smoking? You get money throughout the pregnancy,
You can,
Desmond?
there's some incentives. So certain hospitals nationally have different incentives to stop, to help, to encourage women to stop smoking. That is one of them. Not every trust, does that, but we're just trying to explore all different options because it's such a difficult thing. I'm not a smoker, but certainly if we're going to smoke, we know it's a societal issue. There's pressures, there's, whether from friends or it could be from, the family members to stop smoking. So it's so important to support these ladies throughout pregnancy. And the other thing we'd also do in terms of monitoring through the pregnancy is that we offer these women, extra scans as well, just to check that the baby is growing properly, to look for small babies because they're at risk of stillbirth, as Dion rightly said. So that's extra care we put in place to support them throughout the pregnancy. And we'd keep repeating the tests, at every visit, every appointment, we talk about smoking and we'd reiterate the risks again of smoking. So it's having these conversations in a way and trying to support staff to have the conversations in a way that you're not, you don't want them to disengage, but also to keep them, engaged in the service, and talk about the risk of stillbirth, small babies, placenta separation, and other risks associated with smoking, for example, preterm birth, etc. So very
Wow.
important area.
Incentives to stop smoking.
Yeah.
Wow. That means they want to take it on a different level. Incentives for you to stop smoking. That is very, very interesting. Now, still on you. Alcohol. A pint, okay. 2 pints a week, okay. During pregnancy.
We shouldn't encourage any sort of, alcohol really during pregnancy. At the very extreme is where you could have what is called fetal alcohol syndrome, and that can lead to certain developmental problems in the baby. So then, if the woman for whatever reason is drinking, again we need to engage with social services whether she needs any additional support. She might need support groups in terms of alcohol anonymous, etc., to support her throughout the pregnancy. And also she may need to have special scans in pregnancy by specialists to look for abnormalities in the baby. So we see more or less of the alcohol element. I think smoking tends to be the bigger factor that we see in terms of the risks, but it's still certainly there. And again, we have processes in place to try to support these ladies to reduce alcohol intake.
Okay. All right. Um, there is a question here. And then I think Dion will be able to give us a very beautiful answer to that. Are there particular types of meals or dieting that a woman can have so that during labor they can have a very beautiful birth, easy birth?
I think we want women to be in the best health, to grow their baby in the best way, and that does mean eating lots of a varied diet of lots of vitamins, so fruits and vegetables, and we want them to eat the right amount of protein and carbohydrates. We want them to have a real balanced diet. There are certain foods we want them to avoid, fishes that contain high amounts of mercury. But eggs are safe now. We don't discourage. We just want them to think about things that will be healthy, and so they're in good health to have a baby. If they're strong, that will help them to give birth. A beautiful birth is always beautiful. Women do a great job.
All right, Dr. Stephanie, you are an African, right? African mama, right? So, Naija, you know, Eba, you know, Agushi, and all those things, right? You have to tell your African women, oh, which of these ones should they eat during pregnancy?
I think it's as Dion said. I think it's just about maintaining a healthy diet. So I don't think there's anything wrong with having egusi, which is mainly kind of green based. Having kind of meat, like the chicken, the beef. I would potentially avoid some of the shaki, the pomo, some of those things. But chicken, beef, things that are cooked well. There's no need to kind of avoid kind of protein. Nothing wrong with having kind of rice, all of the kind of staple foods. I think it's just about being kind of sensible, making sure, as Dion said, your diet is balanced and varied. So I wouldn't have kind of all of the egusi and all of the heavy foods every single day, but there's nothing wrong with indulging in them. I think as long as the meat is kind of a high quality, cooked properly, and you're kind of watching what you're eating, making sure you're having your vitamins as well as kind of all of these other things. I don't think there should be no reason why you can't partake in our usual kind of cuisine at all.
Okay, all right. So, black women, carry on. Enjoy your beautiful meals. Now, let's talk a little bit about black women after birth. That is also equally important. They've taken care of themselves during pregnancy. They have delivered their babies beautifully by the team of midwives. They've come home with their babies. Such a very beautiful moment. But that is where extra job begins. What are some of the things that they should take into consideration? I know there are issues of mental health. There are issues, quite a lot of issues when babies are brought home. What are some of the things that black women should also take note of after birth? I'll start with Jasmine. Yes, and then we go to Dion.
Yes. Yeah, so I think you have the joy of having a baby, and you think, well, you have your baby and you go home, and then you think, you've done your job, and then that's when the hard work begins. So I think the important thing is from still in the pregnancy, we start preparing women for what to expect during childbirth, and also we also provide information in terms of what to expect after childbirth. And even, so once a woman is on the ward, or she might be in community, or she might be on a low risk unit, and we'll talk about looking after her mental health. So we would encourage about signs and symptoms to look out for. If she's feeling low or feeling down, what support she can have. So midwives would normally tend to visit, women, after birth, even up to 10 days, etc., and might need support workers as well. So we encourage them to sleep, because sleep is also an issue, because you've got a baby who's crying, and how trying to balance that, make sure she's got support from the partner or from the family. We try to educate around, looking for signs of if she's bleeding a lot, because one of the things we've noted in the statistics that black women are also more likely to represent a hospital with problems as well in terms of bleeding or infection. So we alert them to what to look out for. If they're feeling unwell, that they should present early, and again, contact the maternity unit. So we encourage them to look at that. Any sort of support from social services normally encouraged. And it's just a matter of trying to juggle things, A lot of the time, partners may take some paternity leave. They may be on their own. So they need to be telling us what additional support they might be needing, having these conversations with the midwife. But the midwife would then tend to do a thorough check. Some of these women might need to have input from their GP if they've had other complications like blood pressure, diabetes. So they may need to go for extra checks. And again, we tend to have a standard, 6-week check again that we would do for all women, and Black women are no different. So they just need to be vigilant, and we provide them with information, during pregnancy and after. So you have a bit of a checklist that we go through with them, and also for their baby as well, to look out, if the baby's not feeding well, breastfeeding, and looking for signs of low sugar, and again, contacts that they can have to represent if they've got any concerns, and that's the key thing that they should be knowing about.
Interesting. Um, this is a tough one. You made mention of one thing, breastfeeding, right? And I don't know about Stephanie, but there are some Black women. They think when they breastfeed their children, their boobs may drop, right? And they want it standing, right? Dion, please advise them for me, okay? Advise them for
So
me.
yeah, on breastfeeding, what we know is that human milk is best for human babies. It's such an amazing milk to feed your baby, and so that's what they are designed for, and that's what we really encourage you to do. The benefits for you and your baby are massive. There's lots of things to say that it can prevent cancers with you. It can help with weight loss. It gives the baby all the antibodies that you've created over the years. It's absolutely amazing to be able to give your babies that are breastfed are less likely to have problems with their guts. Their jaws develop differently. There's lots of amazing reasons why breastfeeding is best.
So the benefits outweighs the possible drops, right?
Women have all different size breasts, and some women gain bigger breasts after breastfeeding, some women gain smaller breasts after breastfeeding. There's no one size fits all. So yes, we encourage everyone to feed their babies
To feed their babies, yeah.
and support them to feed their babies. There's lots of support out there. We talk to them about the realism of breastfeeding. It takes time to breastfeed your baby in the day, and we talk to them about expectations, where to gain support. That way, they go into it with a realism, which and we as Yasmin said, we do regular checks on them, a top to toe check. How are their breasts doing? Do they need support with position and attachment? Because we know it's a journey. And then signs that the baby's feeding correctly. And Yasmin said, any concerns they can contact us. Yeah.
Okay. Any concerns, please get in touch. Another interesting question here, and I'll let Stephanie handle that. This person is saying her sexual drive is gone after giving birth. What could cause those things to happen?
So during kind of labor, childbirth, your body kind of is going through loads of hormonal changes. And so sometimes after a woman has given birth, she can maybe find that her libido has decreased and kind of her sex drive has gone. I think that for some women is just a kind of a part of some of the changes in hormones that their body has gone through. So it can sometimes be related to that.
Oh, I see. So, is there any way to treat that when women go through that? Is there any treatment for that?
That's a good question. I think so. I will ask my colleagues potentially to help with this as well.
That's all right.
I I would have thought maybe with time, it's something that will resolve by itself, will resolve naturally. Once a woman's gone home, after with enough time, it's something that should kind of on its own resolve. But I can ask my colleagues to see if there's anything that can be done
Yeah.
specifically.
Yeah,
in
yeah.
the short.
Because this person, looking at the dialogue I've had with the person, um, she's not gotten pregnant before, but she's had conversation with friends here and there, and that alone is putting her off from getting pregnant. So there is medication to handle that, that will help a lot. So Jasmine, if you can help in that regard.
Yeah, yeah, it's. I think women. It is experienced by women, and we've talked about, as and Stephanie said, it's a bit hormonal, and again, it's a bit about supporting them through that. Other things might distract them altogether, just because you got care for a baby and you have demands of your partner. You know, it's just a complicated time as well to adjust. So I think it's supporting them through that transition. If it is going to be a long-term thing, now there are interventions. For example, there's this testosterone. That's one of the hormones that could potentially, we know, support in terms of libido and sex drive, etc. So that would be a last sort of resort going down the line. But we'd think with time that is a matter of just supporting the transition. And also you've got estrogen levels drop. Some women experience as well dryness in the vagina. So sometimes it might be, you have estrogen cream. So there are other things that may help to support in terms of the physical activity as well later on, which we can think about. But these would be the medications that would be later down the line, and we can reassure women that it's a natural process. And again, with time, we would expect that they would be able to get back to business.
Well, I'll ask Dion. Should we say that after birth, your sexual drive will never be the same? Can we say that?
I don't think we can say that. No, I think having a baby is a massive, as Jasmine said, transition in life. You have babies that are nocturnal and they feed 3, 4, 5 times in the night. You are very tired. The responsibility of that is big. You still have your other responsibilities to do, and I think it's normal for you not to be for that to be the top of your agenda. Yeah.
And I guess the other thing to add as well, there's a perception as well that things have changed down below. So there's the because with childbirth, the vagina, things expand, and there's this thing about whether it's loose. So these are all physical, and these are questions that women have concerns about, and they think, and that's why you'd be surprised that some women come requesting cesarean sections just because, again, they're worried about what's going to happen if they have vaginal birth, or it'll affect, their bits down below, and it will change, or their partner will then not perceive them in the same way. And there's also sometimes partners who actually observe childbirth. What's their impression if they actually see the baby coming? Some men become traumatized. You'd be surprised by the whole experience because of that. So some men who might prefer partners, or might want to stay behind. So it's multifactorial, and I think it's about supporting the experience, especially if it's the first time couple to go through that and have these conversations and to be aware of the changes that can occur.
Okay. All right. Just a few minutes before we round up. Support that partners should give their women during maternity. Very important. Yes. What kind of support should the men give the women during maternity? There are some men, they don't care. Even with a big belly, they still want to do their business every now and then, just as before pregnancy. What support should men give women during pregnancy? I'll start with Dr. Stephanie. Dion will come in, and then Jasmine will round up on that for us. So, Dr. Stephanie.
So I think it's just about being kind of there emotionally for your partner. I think that's one of the first things you can do. I think pregnancy is a massive change. Your body's going through a lot of changes. You're growing a baby. And so I think it's important to have a partner who is kind of supportive, who listens to your concerns, who's there for you emotionally as well, who understands that potentially you may not be able to do all the things you used to do around the house or in your day-to-day life, and who's able to kind of come in and provide that support in those areas. I think it's also about encouragement when you're going through the labor process, having a partner who's there to hold your hand, who's there to kind of encourage you through childbirth. I think that is important. Someone who's engaged, so who comes to the booking visit or comes to kind of all of the scans, or if they can, and is there throughout the pregnancy, who kind of cares about what's going on, who actively takes an interest. I know when I was kind of looking through lots of literature, some organisations also talk about, particularly for Black women, it's important to have an advocate, and your partner can often be that person, someone who's there to also speak up on your behalf. So I think those are kind of some of the ways that a partner can really support a woman during kind of the pregnancy and the childbirth process.
Don't worry, you get all that support, okay? You get all that support. Dion.
Yeah, it's having a baby is about birthing parents as well. So your parents together, you've created this baby, and it's about looking after each other and caring for each other, and really being there and stepping up. And as Stephanie said, with the birthing process, you can be a real team and you can look after each other. That's the aim of our services, is to help you look after each other, and we're there to support you. So that's the aim, and just to be mindful of each other and be kind to each other is really, it can be a stressful time having a baby. There's lots of emotions, lots of worries, lots of excitement, lots of competing issues, and it's about looking after each other and being kind to each other, and thinking outside the box a little bit, it's about caring for each other. That's what we want.
I see. So for instance, before pregnancy, me and my partner, we used to smoke together, we drink together, right?
Yeah.
Now she's pregnant, and she's been encouraged to quit those things. should the man also try to quit as well, so that he wouldn't be enticing the woman to join in, or what?
Absolutely. You're going to be there for your partner, and it is about stepping up and doing those things. It's just as important that you're not smoking around the mum and around the baby when the baby arrives. And if you're smoking, that's going to be so much harder for her. So yes, do it together. Let's do this together. We're parents together. Yeah.
Let's do it together. All right, Jasmine, a little bit on that, yeah?
Yes, it is a difficult one, but it's an evolving journey, and I think knowledge brings strength, and we have to accept that there will be the unknowns, and it's about learning, appreciating each other, and whoever the partner is, because now we just don't talk about men, as you know, we've got same-sex couples, so it's all about. And that's a new journey for example, the same-sex couples, or it could be heterosexual. So it's just about that support and identifying different roles, realizing that you've got hormonal changes, there'll be mental health, challenges as well. There may be financial issues, there'll be time pressures, you've got balancing jobs. And I think if people are struggling, they can also speak to family. There's family to support. You've got midwives, you've got GPs, you've got other healthcare professional support workers, and there are also support groups as well that they could also turn to, and to support them through that process. But I think anybody who has a child will say there's nothing like it, and those of us who sit from at the other end of the table, there's nothing like it, and it's just a matter of, I think, going through support channels, asking questions. If in doubt, ask. And somebody has been through what they have been through, and there is an answer. And also, whether it be through leaflets, we provide them with, again, Padlets, the apps that Dion talked about. There's always, information is always changing about pregnancy and childbirth, to support partners and how to support the pregnant woman after. So I think there's a lot out there, and it's just making sure we can point people in the right direction, to ensure they can access the information as well.
Beautiful. The bottom line is, there is always support for you along the way.
Indeed.
There is always support for you along the way. Dr. Stephanie, you are the PRO of One-to-One Mentoring Network, right?
Yes.
Yes. Tell us a little bit about that. How one can access your services, your support as well, before we round up.
So all of our resources can be found on our website. That's one-to-one-mentoring.com. Through there, you can access our mentoring scheme. You can find out a bit more about what we do. We also have links to our radio debates and discussions, such as the one that you've listened to today. So one-to-one-mentoring.com. Visit us there, and all of the resources can be found there.
She kept it very easy. Go to one-to-one-mentoring.com, right? You will find everything there.
Everything there, the social media, everything that you
Yes,
need.
everything. The Facebook, the have you got Twitter?
We do have Twitter, but I think we need to be a lot more active on the
okay.
Twitter that we have.
Okay.
But we have Twitter, we have Instagram, Facebook, LinkedIn, everything.
By you yourself, you are not active on Facebook, are you?
No,
you see, PRO, you have to be active there. You have to be very active, right? All right, so she kept it very simple. Visit one-to-one-mentoring.com. You have all the information that you need over there. So, Dion, tell us before we go, in total, how many children or how many kids have you embraced into this world so far? 1,000, 2,000?
Yes, I've had lots of ladies support giving them to birth their babies. I also help ladies through the pregnancy journey have babies physically at birth. Yeah.
Oh, okay. And then how do you feel about your job so far? What kind of feeling do you go through when you're able to do all the things that you do?
Yeah, I love my job. I love helping and supporting people having babies. It's magical and amazing. There are some times that are challenging and difficult, but we show kindness to our families and also to each other, and that's really I love it.
You love it. I like the sound of that. I love it. 15 years, right?
Yeah.
Keep going, okay?
Thank you.
Keep going. Thank you very much, Dr. Stephanie, Jasmine, and Dion, for such a very beautiful discussion that we've had today. It is very important that we look after women, especially our black women. We put away their fears. We show them the support that is there for them during pregnancy. We give them the guidelines that they should follow to make sure they have a very beautiful and safe delivery as well. In the course of the discussion, one thing that has been so clear to me, the very moment you are pregnant, remember, there is certainly support. When you go to Dion, she will support you beautifully. Get the support that you need and make sure the journey becomes very smooth. In fact, we say it is smooth, but the women, they will tell us it is not that smooth. It has its ups and downs. That is why the support is there. And after birth, that is not the end. The hard work begins after that. Partners are also to support their women during pregnancy. Very, very important. We should be very considerate. Very, very important. Thank you very much, my beautiful women, Dr. Stephanie, Jasmine, and Dion, for this very beautiful discussion. When are we coming again? Dr. Stephanie, when are we coming? Are we coming before the end of the year, or we come after New Year?
We come after New Year. We've got a big agenda plan, so stay tuned. We're going to keep you busy next year.
All right, then. Enjoy your weekend. And then pepper song for you, Dion, okay? Bye-bye.
Thank you. Everybody.
To live and not know what state of God you are, it's a disaster. To not know your purpose is a tragedy, it's a disaster. To live and not know what state of God you are, it's a disaster. To not know your purpose is a tragedy. It's a disaster. You may tomorrow be gone. Tomorrow may never come. Wake up, wake up, wake up, wake up to purposeful living now. That in this you will build your soul. In this you will be the difference. In this you will be the answer to the prayers of humanity. In this you will build your soul. In this you will be the difference. In this you will be the answer to the prayers of humanity. To live and not know what state of God you are, it's a disaster. To not know your purpose is a tragedy. It's a disaster. Sunshine, rainfall, half spins, the wind blows, harmony, symphony, purpose. Sunshine, rainfall, half spins, the wind blows, harmony, symphony, purpose. The world is waiting on you. Do you feel free? The world is waiting on you. Shine, oh shine, yeah. Shining like a star. Oh, shining so bright, yeah. Ooh, 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 yeah. You may tomorrow be gone. Tomorrow may never come. So wake up, wake up, wake up, wake up to purposeful living now. In this you will build your soul. In this you will be the difference. In this you will be the answer to the prayers of humanity. In this you will build your soul. In this you will be the difference. In this you will be the answer to the prayers of humanity. To live and not know what state of God you are, it's a disaster. Oh yeah. To not know your purpose is a tragedy. It's a disaster. So wake up, be the difference. Heba, Yanni beat.
Edi enjabo na wowobo. Say ye dintuo.